Hello and welcome to Women's Football Hub. I am your host for this episode. I am Carolyn Kent, and joining me today is a woman who is an associate professor at the Faculty of Health Science at McMaster University in Ontario. She's the director of pelvic health at the World of My Baby, also called The Womb. She has 20 years experience as a physical therapist, and if that wasn't enough for you all, she also has her PhD in Health and Rehabilitation Science. Welcome to Women's Football Hub, Dr. Sinead Dufour.
Hi, Carolyn. Thanks so much for having me.
Thank you very much for coming on. I really cannot thank you enough for coming to speak to us today. So we're going to talk today about basically pregnancy and the kind of female athlete. So obviously it is one of your specialist areas. So can we start first of all kind of by thinking about what are the changes that a female athlete's body would go through once they become pregnant?
Yeah, of course. Great place to start. So, when a woman becomes pregnant, actually every single body system is impacted, right? So, there can be certain body systems that we might think of a little bit more when it comes to athletics, especially depending on the type of athletics. But if we're thinking even around kind of football specifically or those types of things, I'll get into that a little bit more. But really and truly, cardiovascular, we have a huge kind of increase in the demands on the system when it comes to even thinking about our pelvic floor, which is sort of really important when it comes to any type of kind of loading and load transfer through the body. We have sort of changing demands from that perspective. We have changes in our bowel function and our musculoskeletal system, and even in our hormone profile and some of our immune adaptations and so on. So we could kind of go on. But a lot of the times, if we're thinking of kind of the cardiovascular metabolic piece, and then when we're thinking of loading exercises, sort of where I'm specialized, we're thinking a little bit about sort of the pelvic floor. So we have certainly every single system is impacted. So it is a time in an athlete's life where we do want to acknowledge these changes, but it doesn't mean game over, right? And I hope that that's a big message that comes out of today is really we have lived in a place where we haven't known a lot actually about the athletic pregnant woman because we haven't really studied it. And no data has been sort of the answer is no. And that's actually kind of starting to change. So yes, every system is impacted. A few systems I think are more important than others. And there are considerations and things that we absolutely have to consider. But it doesn't mean we have to stop.
And from a perspective of changes, obviously said cardiovascular respiratory is obviously affected. How would those changes affect a football player with regards to, training, etc.?
Well, because we have so much more like now demands through those systems, because we're growing a human being, it just means in most cases that we have to sort of modulate the demands we're typically putting on ourselves because we're taking up some of that reserve already. So absolutely, is it going to mean at, a certain juncture, you're probably going to have to kind of wind things down a little bit? Yes, it does. We're taking up some of that buffer capacity. But at the same time, we also know, and this is where some of the thinking is changing a little bit, we also know the impact that deconditioning has on those systems. And so it's equally unhelpful to kind of prematurely tell an athlete to really, really scale back because of kind of a culture of fear, just because we don't know. And then actually we have the impacts of, yes, more demands on the body, but also, we don't have the fitness capacity for it. Because traditionally in rehab, our approach has been, okay, you're having an issue. Let's build up your system so you can manage this demand. And it's interesting, when it comes to pregnancy, we've sort of been taught to do the opposite. We have these increasing demands. And instead of working with someone to help them to build capacity to meet that demand, we're telling them to scale back. And that's why there's a number of us, myself included, who are really working to try to challenge this narrative and really actually start to put forward research to substantiate this other mode of thinking, because we actually don't have any data to substantiate the other side. that very much is, we have no data, but it's just, a thought that, probably, since we don't know, be ultra conservative and pull out. And so, yes, is it likely that athletes at certain times are actually going to have to scale back, and some more than others, because pregnancy is so biopsychosocial. There's other systems that come in play. So the influences are very individualized. So yes, are people going to have to scale back? Yes, but we also want to think of that deconditioning piece too, right?
And I suppose that's the case. If you allow an athlete to decondition, it's more difficult for them to get back to where they need to be. And I suppose that the process may take a little bit longer. But like you're saying there, it's a very individual process. So let me ask you then, what type of guidelines are out there? So say you're a newly qualified practitioner, you've gone into a club, there's nobody else except you. What are the sort of guidelines with regards to activity versus exercise for kind of women in general with regards to pregnancy?
So for women in general, there are some guidelines. They were updated again a couple of years ago, and they are fairly clear. Now, I would still say they are based on data that isn't as robust as probably what we need. But I'd say those guidelines for the average individual are pretty decent, and they represent pretty well kind of what I would actually see in practice. So I have that benefit of being a researcher and a clinician. And really, it's around making sure that people are getting sort of 150 minutes of very low impact, low intensity exercise. So like walking, getting sort of about that same much about medium intensity exercise, making sure that we have a combination of some, low grade resistance or strengthening exercise, some flexibility exercise in there. And actually, there's a very specific recommendation to start engaging in pelvic floor muscle training. So that recommendation has made its way into almost every single clinical practice guideline across the world. And that's an important one because, I am still met with people coming to see me and say, oh, you know what? My coach or my doctor or whoever else I've been interfacing with told me that I didn't need to be doing pelvic floor muscle training. But actually, as soon as you're pregnant, it is a generic recommendation across the board. And I would argue for anyone who's involved in exercise, so even recreational athletes, to me, they're athletes, right? And I would say anyone in that camp actually goes into pregnancy with two independent risk factors for pelvic floor dysfunction, because being pregnant in and of itself is one, and then actually being someone who participates in any type of high impact activity, that's another one. So it stands to reason why, yes, this is an important activity recommendation for everyone, but I think it's especially important for athletes because the whole sort of space of pelvic health seems to have got like stuck outside the door of the athletic circle, right? I would say the same thing about what we've learned about pain science over time. It just hasn't made its way into sort of sports science. So yeah, those are the general recommendations.
So let's go back to basics then, just for any players that might be kind of listening. What are the benefits of exercise for a woman who's pregnant?
Yeah, so I mean, there are many. So if we talk about some things kind of specific to the pelvic floor first, and then I'll kind of come out a little bit more general. We know that people who have been exercising or have higher fitness even before they've become pregnant, they actually are less likely to develop something called pregnancy-related pelvic girdle pain and other musculoskeletal pains in pregnancy. We also know that people who are exercising ahead of going into pregnancy have a much more likely ability to sort of manage their metabolic health, right? And as we go through, we see like kind of through time, we see an increasing incidence in things like metabolic dysfunctional, gestational diabetes. These issues are on the rise for a whole variety of reasons. And really, like our strongest data to mitigate those types of issues is exercise, right? And when someone has gestational diabetes, that actually does correlate with more sort of intervention in the birth. And more intervention in the birth actually correlates very directly with more pelvic floor trauma. And so you can kind of see how these will map out. And then, of course, people who exercise through pregnancy, we have tons of data to support better mental health outcomes. We have lots of other data just to support general kind of quality of life outcomes, fitness capacity, etc.
And I think one of the things I'm kind of, when I looked over the kind of notes before I came into this podcast, was I went and had a little look at, what research has been done on, pregnancy and with regards to exercise. From your perspective, what research needs to be done with regards to exercise and pregnancy? And I'm going to put a second question in there. I think one of the things I thought about was, well, the ethics process with regards to research and exercise. How do we mitigate kind of some of the issues that would come with regards to ethics?
Yeah, absolutely. These are great questions, Carolyn. So the one place my brain goes to first is this issue of contact when you're in a contact sport.
Mm-hmm.
And, I think of that partly because myself and other collaborators, you'll be talking to Margie Davenport. She's the lead on this particular project, so she can maybe speak to it a little bit more. But this issue of contact when you're pregnant. So right now, kind of as it stands, there is this very sort of conservative, unanimous perspective that once someone is 12 weeks pregnant, boom, no more contact whatsoever. And again, that's really based on a highly conservative perspective or best guess of what's in the best general interest of baby and mom. And actually, we have done some preliminary research in our plight to kind of challenge some of these narratives that just aren't research-based. And kind of fun from some of the research that we've doing, very kind of preliminary exploratory research, we're seeing that there's a number of athletes who are actually cracking on with some contact and continuing on because of the myriad of other benefits they're getting from continuing on in their sport. And from this work, we're going to kind of build on to other kind of more rigorous methods to sort of see, like, how can we honestly get better guidance when it comes to something like contact? Because there can be a lot of harm actually for a lot of our other systems pulling someone out of that context, right? So that's one area. The other area is kind of much more intense exercise. So we have a reasonable bit of data for sort of low intensity, moderate intensity. As I said, our clinical practice guidelines there, in my opinion, are decent, but they aren't necessarily going to apply to our higher level athletes or those athletes who just want to do that more intensity. So these are kind of other places where we need more research to really sort of see, like, what is, and everything's always a weighed out benefit. Like, what is the net benefit in this particular person's case, for pulling out or pushing through or modifying this way, or actually allowing XYZ intensity to go on. And because there's so many other things we can actually do to kind of support and buffer athletes in pregnancy, and some of these strategies really are not tapped well, there's lots of room to kind of explore these other areas where we can go harder, but we're really going to support recovery in a much more intentional way. We just haven't really looked at it like this. So I would say those are two areas: really, really intense exercise and then contact.
Because I know that there was some research done on like CrossFit athletes and talking to them retrospectively about did you have any issues with regards to pregnancy? I know there was some sort of research there with regards to that sort of high intensity interval training. What are the sort of recommendations around about high intensity with regards to, I think there's some evidence with regards to duration and intensity.
So really, when it comes to higher intensity, this is where literally the criterion is just much more conservative and reverting back very, very quickly to, the commencement of other symptoms that might come up, pain, shortness of breath, some of these things. But when it comes to higher intensity, this is where there are like limitations on what is accepted. And certainly kind of as the pregnancy goes on, there's less and less acceptance for this. There aren't currently generic guidelines that explicitly include this type of activity. It's the very reason why with, the team I work with FIFA, We're in the process of developing these guidelines right now. They just don't exist. We have more for athletes in the postpartum period, right? There's some new guidelines that actually just came out today. But as far as for pregnancy, for athletes and guidance that's actually useful for coaches and people on the ground, we don't have that as of yet, but we're going to have it soon because we're working on it. But really, the higher intensity piece is where things get a lot more gray. And that is where it defaults much more to, base it on your own personal symptoms, your own personal context. And while that's helpful, we still recognize that coaches and people working with the players right on the ground, they still need more signposts and guidance to make these shared decisions with athletes. So just kind of telling an athlete to just based on you feel with high intensity, that's just not good enough. And that's why we're working on this.
I agree, and I think if you've got kind of people that are listening that are maybe working with kind of athletes, and they've come to them and said, I'm pregnant. Are there any sort of screening tools that can be used with sort of female athletes?
Yeah. So again, none of this kind of across the board actually properly exists in a sort of easy to mobilize way, which is why podcasts like this are really, really helpful. But certainly we kind of have our general sort of exercise and pregnancy screening tool that's recommended also to be used by athletes. But then we actually are in the process in some of the work that we're doing. We're also suggesting that given that athletes really do have that double risk factor for pelvic floor dysfunction, and what I will say about pelvic floor complaints that a lot of people don't know is they are often one of the main reasons why people end up having a shift in their performance, having a shift in their confidence, pulling sort of away from training in a particular way. There's a lot of fear and shame associated with these symptoms, particularly with ones that we might be thinking about pelvic organ prolapse, where there's like a heavy feeling down there. There is so much fear associated with that. And even that whole construct of fear once you're pregnant and exercising, fear actually is a bit of a beast that intersects in many ways. So it intersects kind of with these pelvic floor symptoms. It intersects with people being worried about something called diastasis rectus abdominis and what does their tummy look like when they exercise. It is a key feature that underpins pregnancy-related pelvic girdle pain. And so even this whole place of like minimizing fear in this space, I think is really, really important. But pelvic floor screening is really, really important. So there's some very basic screening tools. The pelvic floor dysfunction inventory is a 20-item tool that really, it's very quick to administer. Anyone supporting a team can sort of administer it to a player. It doesn't have to be a regulated health professional. And it will just give you a lot of insight in terms of kind of that system in the body. And when it comes to those pelvic health issues, a lot of people have thought, well, if I unearth this information and find it's a problem, like now I have to have my player access a pelvic health physiotherapist. And like there isn't one we can access, or my player is not particularly interested in having sort of an intravaginal exam to check their pelvic floor. But what we know now with pelvic health physio is we have really good data to support how good virtual care is. So even just one consultation with PT, you can get a lot of individualized insight to kind of move that along. So I would say, yes, we have your general screening. We have the pelvic health screening. Another form of screening that seems to be really important for athletes is actually looking sort of at energy availability and what we often call as red S, because we see that, when it comes to pregnancy, that's another issue that is happening at a higher proportion with our athletes. Athletes identify quite a bit with sort of their body and having a strong body. And we do see that there are higher amounts of disturbances in energy balance and, controlling eating and pieces like this that people aren't thinking about. So even doing kind of some screening on that side is one of the things in the work that we're doing that we're trying to tease out and recommend. So absolutely, we have our normal generic sort of pregnancy screen that's kind of for anyone. Then we have our pelvic health, we have our energy system, and also mental health. So that's another kind of screen that we really recommend. And this should really be weighed in to the risk benefit of an analysis of having, an athlete kind of pulling more away from sport or not. Like, where is the net benefit? And kind of using that as another kind of signpost to sort of make decisions.
And I think, obviously you touched on earlier, when to stop playing with regards to football. And there's always been this sort of, end of the first trimester, 12, that's when we should kind of think about stopping playing, especially with regards to contact. Now, talk to me about contraindications then. When should somebody absolutely, you have to stop?
Yeah. So the good news is most of the things that pop up we would call considerations, and really it's an opportunity for us to work around. As far as frank absolute contraindications for activity and carrying on, it's having any sort of persisting pain, sort of either in the chest or in around sort of like the womb where the baby is, the abdomen, like persisting unrelenting pain. It's having sort of persisting premature contractions. It's having any type of bleeding that's kind of starting up from the activity. It's having any sort of dramatic shortness of breath and really, really kind of feeling breathless as you go on. Those are honestly the main ones, right? We really want to make sure that anything that potentially is a signal of your cardiovascular system really being in compromise, and even just from the physiology of pregnancy, for very unknown reasons, these issues can happen. Like, I've often been surprised that athletes who are in the best possible shape sort of end up with gestational diabetes. And I think, how can this be? But, we're learning now this has to do sometimes in ways of how the placenta is actually embedding in, and how that sort of physiology profile is kind of, myriading after that. So really anything that is kind of an indicator to any type of like cardiovascular health being compromised, or any type of premature contractions or premature labor, which unexplained bleeding could be that, and the initiation of contractions, definitely these are times where we kind of want to stop and make sure there's a full evaluation. Historically, I'll say, these types of symptoms would lead to a workup. And then usually the behavior after that would be bed rest or modified bed rest. But one of the things we're just slowly starting to see is how detrimental that is. And actually seeing that when we are resting and when we're stagnant, that's actually highly inflammatory. And so kind of highlighting that that can actually be doing in ways more harm than good. So it's almost a matter of starting to rethink of really sort of specific, tailored types of lower intensity exercise that's more therapeutic in these times to mitigate some of that. So again, our thinking around a lot of this is changing, but absolutely, those are some absolute contraindications. And other kind of big absolute no-nos at this point for exercise is exercising in extreme heat, exercising at extreme altitudes. So these are things that right now are actually considered like contraindications in pregnancy.
Lovely. And now, what would be your top take homes if you were kind of working with a pregnant athlete?
So my top take homes would be understand that a lot of the current narrative has really been spun around concepts that are not backed up or substantiated, right? So that's one. So having a degree of your own sort of curiosity and your own kind of trust in your body and listening to your body, I think is really, really important. Also understanding, how helpful it is to continue to exercise and be sort of engaged with your team, even if it doesn't necessarily mean contact after 12 weeks, but that recommendation might be changing, thinking about all the good exercises doing. And then the other thing is to really be aware of the kind of elephant in the room that is fear. So this construct of fear that can pop up in pregnancy, be aware of it and sort of get curious, because in many, many instances, fear is something that's sort of getting in the way of an athlete being able to continue what they do, or even if it's just fear of the birth process or fear of what might happen in the postpartum period, and you start thinking about it in the pregnancy. So these are kind of three things that we can tackle easily, and I'd want people to think about. And then I guess a last one is don't forget the pelvic floor. Even if you're not having any symptoms, the guidelines are that if you're pregnant and you're an athlete, you have, that double risk. That is a time to learn how to engage in pelvic floor muscle training. This doesn't mean you need to see a pelvic health physiotherapist. That's definitely gold standard. But even using a really evidence-based app like Squeezy, doing one virtual consultation with someone who's really good at what they do, that's also something that can help. And your pelvic floor is really almost like your core of everything. So taking care of that part of your body can really go a long way through pregnancy, having a great birth, and then being set up well postpartum.
Lovely. Now, Sinead, you spoke earlier on about a lot of this can actually be done virtual. If somebody is thinking after listening to this, I'd really like to talk to Dr. Sinead Dufour, how can they do that?
Yeah, so they can connect with me through the womb, the world of my baby. That is where I run my clinical practice at this point. Most of the care I do at this point actually is virtual. I see people from all around the world. There are other great PTs who do the same. But yeah, if you can find me at www.thewomb.ca, that's how you can connect with me.
Sinead, I can't thank you enough for coming on the podcast. It's been absolutely lovely to hear all of the expertise that you have. For those of you that are training with athletes, please train them well. Please make them think about their pelvic floor, especially if they're pregnant. And we will see you soon.
Thank you for listening to Women's Football Hub. The information within this podcast is for informational purposes only. No material on this podcast is intended to be a substitute for medical advice, diagnosis, or treatment. Please contact your doctor or another healthcare professional if you have any questions about anything raised in this podcast.